Cookeville Regional Medical Center, the Upper Cumberland's proven choice for healthcare. Here's Jill Bowling.
Babies, babies, babies. At the Birthing Center at Cookeville Regional, we've recently expanded and updated our birthing center for our new moms and our new arrivals. So come join us and take a look around as we learn more about the Birthing Center at Cookeville Regional.
Now we've expanded with 5 more labor and delivery rooms. We have 6 observation rooms so that when mom comes in and she's really not sure if she's in labor, she would stop at our registration, which is very convenient, right outside the department, and they would direct her where she needs to go.
You know, the developments that I've seen over the last few months with the remodeling have been quite fascinating, really. I think the people in the surrounding counties are very surprised, happily surprised at how much we do have to offer. That's quite something when you can tell somebody you have 12 delivery and recovery areas. And the triage area has probably been my favorite that's been added.
This is one of our labor rooms. They're all private. 2 of the 5 rooms are a little bit smaller, so we have a sleeper chair for the daddy or person that you want to stay with you. We have all new labor beds that you can do natural labor. You can have an epidural. These beds, they'll do just about anything that we need to. They're very comfortable beds. I'm proud of this little feature wall, I guess, because it has all the stuff kind of built in it, so you don't have to see anything when you walk in here if you're stressed out. And of course, we do fetal monitoring, and we have a new upgrade with our computer system so that we are doing all electronic documentation now.
A very special part of the expansion is the new nursery.
And now we have 2 nurseries, kind of. They're divided a little bit, but they're for well babies so that we can hold up to 32 well babies. We also have an intermediate area that's called a suspect nursery, where if you suspect that they're not well enough to be with the well babies, we put them in there until we find out what's going on. They may need a little extra care.
I didn't know that they had that area, but it's been nice because she's received so much care. And I'm able to go in and see her, and it's been very, very nice to have her in there.
The Birthing Center is fortunate to have a full-time pediatric hospitalist on staff.
Because sick babies often need special care, we have a nursery just for these babies.
Used to, they were stuck in with the rest of the babies, and we could only really keep 3. Now we've got enough room to keep 6, and therefore we can keep the babies here, keeps them closer to home, and keeps them closer to their parents, and just makes everybody a little more comfortable.
Depending on the circumstance, if you're having a high-risk delivery or you're having a C-section, your OB may ask me to come to attend the C-section or attend the delivery.
I'm a pediatric nurse practitioner, so I assist the inpatient hospitalist pediatrician. We together attend all the C-sections and we attend any vaginal deliveries where there are concerns. When the babies get to the nursery, we do a full physical exam on them. Each baby is seen by one nurse practitioner and the physician as well.
I will stay with your baby until it's stabilized, at which point we usually sit your baby up, wave to you, tell you how good your baby's doing, and let them go to you to be in your arms.
Then we do speak with the families and provide discharge instructions and help with teaching. And I like to think that we offer the ability to spend a little more time with each family than what the physician can often do.
It's not just the babies that get special care. Dr. Paige Gerndt discusses that the mother is also looked after with great care.
You know, we do try to limit, of course, really preterm deliveries here, and we maybe eventually be able to do that also. We don't deliver usually under about 34, 33 weeks here, but we have a very nice relationship with Vanderbilt, Chattanooga, Knoxville, so that doesn't seem to be a problem. I feel like all of the physicians that practice here have a very good handle on high-risk obstetrics, including severe hypertension, the preeclampsia, or the old term everybody knows is toxemia, the diabetics, and even now diabetes is becoming quite a broad spectrum disease. We are very familiar with insulin pumps, insulin drips.
I kind of like working back here with the mamas too. It's nice. We have nurses that are very experienced in having natural childbirth with their patients, breathing techniques, relaxation techniques. We have birthing balls, and we'll assist them in whatever their birth plan is.
I work with all of the moms with breastfeeding, And prenatally, I teach the prenatal breastfeeding class and the newborn care class, and then I follow up with the moms, teaching the new moms and babies to breastfeed during their hospital stay. And of course, we also offer the opportunity to come back for a follow-up visit if there were complications after hospital discharge. It's reassuring, I think, to many moms to have an opportunity to come back if they experience a question or a problem after discharge.
We're in the process of getting a full set of pediatric hospitalists. So there will be a pediatrician available virtually 24/7 within the hospital. We do have one pediatric hospitalist now, so during the week, anybody who has a delivery, if there's an unforeseen complication, there's somebody right here, right available, who can take care of their baby, who's had specialty training in pediatrics, so that we can provide a good, safe environment for our babies.
Before, during, and after the birth of your child, the staff at Cookeville Regional's Birthing Center is ready and willing to help you.
We are here to take care of your baby and answer all of your questions. If your baby is ill, we will be at your bedside daily or sometimes hourly if need be to reassure you that your baby is doing well. You will not find more supportive staff or better staff anywhere you go.
You know, your role as an experienced nursery nurse with those skills makes all the difference in the outcome also for that family and that baby, and that is just so fulfilling.
It's interesting to note that even moms that have had 2, 3, 4 babies or sometimes more, each experience is different, so it's helpful to have that support, and I think we have a good team of support.
They will make her feel right at home, and they will walk her through everything from this stressful, exciting situation. And they will make it very, very pleasant for the whole family.
I've been really impressed with Cookeville Regional. I used to work at Duke and I used to work at St. Jude's, and this is a smaller hospital, but the way it works is very impressive. We have a lot of hands-on with our patients, a lot of patient interaction, and the hospital really functions as a total team. Very friendly, very approachable, and they carry on that attitude toward the patients and their families too.
No, I just can't compliment my nurses enough. They have been great the whole time, answering so many questions, calming my fears, and just kind of walking me through it all.
I lost count a long time ago how many I've seen, but it's still a miracle every time.
And I hope to be doing this when I'm in my 80s. I want to be doing patient care. I truly love what I do for a living, and I don't want to stop.
The joy that the mom and dads have, you know, this is the happiest time in their life. They're getting to have their baby, and no matter how many deliveries I've been in, if they cry, I cry. It's just so joyous, you know, to get to be a part of that. And I'd always said, of course, I need my paycheck, but I was like, this is one job I could do and do it for free. You just look forward to coming in every day.
Our staff is happy to answer your questions. Qualified staff is available 24 hours a day. For more information, call 931-783-2297. We look forward to enjoying your childbirth experience with us.
This month in Cookeville Regional News, we would like to welcome several new physicians to the hospital's medical staff. Dr. Don Asbury and Meikle John McKenzie, both pathologists, will be joining Drs. Kincaid, Collins, Glasgow, Hall, Moss, and Nolan of Cookeville Pathology. For more information about these and other doctors at Cookeville Regional, call the Physician Referral Line at 877-DRS-CRMC. Cookeville Regional Medical Center recently announced that it has been ranked the best performing hospital in Tennessee and among the top 10% of all hospitals nationwide for coronary interventional procedures from Healthgrades, the leading independent healthcare ratings organization. In addition to the quality recognition in the cardiac service line, Cookeville Regional Medical Center's orthopedic and spine surgery programs have been ranked among the top 5% in the nation for their quality. The hospital received Healthgrade's highest ratings, 5 stars, across multiple categories, including coronary interventional procedures, treatment of heart attacks, hip fracture repair surgery, back and neck surgery, and spinal fusion surgery. The Birthing Center at Cookeville Regional recently underwent an expansion, and it was unveiled at a community open house. The center now includes 12 labor and delivery suites and a 32-well baby nursery, as well as a 6-bed nursery for those infants needing more specialized care. For more information on the Birthing Center, call 783-2296. As always, we appreciate you tuning in. Have a healthy and safe day.
Cookeville Regional Medical Center, the Upper Cumberland's proven choice for healthcare.